Hi everyone, my name is Fernanda Lozano, and today we're going to be addressing how to reduce child vaccination exemption rates in Arizona and why they are such an imminent problem. So, to introduce this topic, we are going to be talking about how and why Arizona currently is facing a growing rate of personal belief and non-medical exemptions from school vaccination requirements. Out of the 17 states that allow these exemptions to occur, whether they be for personal, medical, or non-medical beliefs, Arizona is one of them. The growing number of exemptions have very negative public health effects, such as reducing herd immunity, which has a drastic effect for all. In 2014, we saw 644 cases of measles, whereas in 2012, measles were considered to have been eradicated here in the United States, which shows the link between measles and the decision to not vaccinate one's child. Herd immunity. So herd immunity is the idea that if you vaccinate the majority, then the few that aren't and the majority that are protected from vaccinated preventable diseases. So as a definition, it's the form of a community protection which a sufficient portion or percentage of the population has been immunized. Currently, our herd immunity threshold within the state of Arizona is 95%, and if this drops below any further, then Arizona falls at risks for an increase in vaccine-preventable diseases such as measles, mumps, rubella, the flu, etc. So what are the root causes of Arizona's high vaccination exemption rate? So for the majority, it is parents that are worried or concerned about the safety of these vaccines and how these vaccines are affecting their children and their health in the long run. There have been findings that show that there are also people known as anti-vaxxers who are anti-vaccinators who have personal experience with people who have been harmed or have experienced a negative side effect due to these vaccines, or sometimes they fall victim to the bandwagon that autism is caused by vaccines, which we now know is not true. So who or what demographic of parents are most likely to exempt their children? So according to the Arizona Department of Health Services, high vaccination exemption rates within Arizona are mostly attributed to white and higher income parents and families. So this means that those who are better off, or maybe they're more comfortable with their income and social status and whatnot, that they're more likely to not vaccinate their children. Why? It could be due to many reasons: religious belief, personal beliefs, etc. We don't know the true cause, but we do know that those who are white and with a higher income tend to be the ones who choose not to vaccinate their children. In April 2019, only 83% of the kindergartners had been vaccinated for the MMR, and this is likely due to the idea that before there was a study done where they thought that autism was caused by vaccines, which now we know, of course, that that's not true, but still parents still have this stigma and this negative belief that vaccines are, quote, poisoning these children. In Arizona, there are also areas or clusters of parents where they want to live a more homeopathic, more natural, organic lifestyle, so they don't want to, in their minds, injecting these chemicals are poison to their children, which they don't want to do. So what does the data show? In this chart, you can see over time, between 2012 and 2016, the religious exemptions and personal belief exemptions have increased. So from 2012 to 2017, it increased from 3.8% to 3.9%, which doesn't seem like a big difference, but we're talking about hundreds or thousands of children. Whereas in personal belief exemptions, it has increased from 2012 to 2017 to 3.9% to 4.9%, which is a dramatic increase overall because these numbers keep increasing as time goes on. So what the data shows is that 60% of Arizona counties are at high risk for a measles outbreak, as well as 8,150 Arizona children in childcare, kindergarten, and 6th grade alone were exempt from every required vaccine in 2018. So these kindergartners are putting the other kindergartners or other elementary school children, all children at risk, essentially, for contracting these diseases when it outweighs the public goods majority. So we emailed and reached out to the Arizona Partnership for Immunization, otherwise known as TAPI. In 2002, TAPI was established, and its mission is to foster an impactful and sustainable program for immunization against vaccine-preventable diseases within the state of Arizona. They are locally based, and they work together to try to inform the public and give the public resources on how to get these vaccines, how to get these vaccines covered, and to answer frequently asked questions about these vaccines, about their safety, the known risks of them, do they cause any fatal illnesses or any disability-related illnesses like autism, and they answer these questions by also working with different other organizations such as the Arizona Medical Association, the Arizona chapter of American Academy of Pediatrics, and other county health and community health centers here in Maricopa County. So in an email we had with their contact over at, her name was Tenny, she told us that the way that TAPI confronts vaccine hesitancy is through various levels of training, education, spread of resources. This is done by working with medical or healthcare providers such as doctors, nurses, and people in the medical health profession to give them a consensus of what vaccine and their importance means. So we want to create this very friendly and warm environment between the patient, provider, and the family, so that there's a link between all these three, so that there's more interaction, more communication, because we have found that lack of communication and information is what's causing people to be more prone to vaccine hesitancy. Tenny over at TAPI also informed us that different locations have different needs, which is what TAPI is focused on. So in Scottsdale, there is a greater push among the parents for a natural, more organic way of living, more organic and natural lifestyle, dieting, and whatnot. Versus in Flagstaff, the focus is completely different. So Tenny over at TAPI told us that they need to approach these different locations carefully, or else that their effectives may not be as effective as they can be. So what works? We have found that different measures that work are establishing formidable relations and goal-oriented partnerships in the community. So this is the bridging between healthcare providers and families, so that people are able to ask questions and get them answered, so there's no miscommunication and there's no room for misinformation to spread about these vaccines. That also leads into providing education and resources that help dispel misinformation. Again, this is to reject the myths that have been in the social media and in different medias to show that vaccines aren't causing autism, or that vaccines aren't deadly, they're not poison. Some even think that vaccines are a government conspiracy, which is not true. As well as another thing that works is to improve the tracking system, or create a tracking system that monitors immunization records, so that there is a healthy and adequate and up-to-date status and record keeping of these children and how they're being immunized, if they need new ones, or what's coming to the market soon, what new vaccines need to be implemented. This is where that comes in. Breaking through language barriers. So there are many families or people who don't speak English, and they're worried about how to approach or ask a question to a medical provider. And by breaking this language barrier, it's a simple fix, as easy as getting a translator or someone that simply speaks the same language, just to answer these questions. And again, we just don't want to have any miscommunication between families, healthcare providers, and especially we do not want these people to be influenced by false media, false news, and false advertisement about vaccines. We also found that requiring parents to review and sign documentation and disclosures acknowledging the risks have been helpful. So this means that when one wants to exempt their child from getting a vaccine, they have to fill out a form which states that they, as a parent, acknowledge all these risks. But these risks are more detailed, and it tells them exactly what they're signing up for. So it says something like, I accept the terms, and that if my child gains or contracts measles, mumps, rubella, poliomyelitis, anything like that they're responsible. And seeing all these risks like outlined and labeled and defined as such has been shown to increase one's likelihood of vaccinating their children because now they know the true risks of what happens when you don't vaccinate. So in California, they passed the Assembly Bill 2109 in 2012, which meant that in order to get a vaccine exemption, one's doctor or healthcare provider had to sign off on it. And this made it much more harder for one to get vaccine exempted, which resulted in a 25% decrease overall from 2013 to 2015. So this shows that, say, all states were to implement this policy, that there would be a drastic reduction in vaccine exemption rates, state and countrywide. So this again just shows the decrease between 2013 to 2014 to 2015 in California and how their assembly bill actually reduced vaccination exemption rates. So Doug Ducey has vowed that he will not sign any bill that may lead to a further reduction of school vaccination exemptions. So this shows an example of how here in Arizona, how policy and legislation is working together to try to fight for the reduction of vaccine exemptions, because again, it's putting herd immunity at risk, which puts the entire public health at risk. So our recommendation for addressing the issue, there are several. So one of them is maternal education should be provided during pregnancy and after birth. So this is as simple as either giving a flyer or giving out resources for one to get information about vaccines, how to get them covered through insurance, different ways to get them, as well as where to get these vaccines for your child. They've been shown to help reduce the vaccine exemption rates, because as a mother is more educated about these vaccines, the more likely they are to vaccinate their child. Implementing policies that other states have shown success with. So just like California had done with passing the Assembly Bill, they have shown a drastic reduction in vaccine exemption rates. The use of exemption forms, which as shown here, is the decision to not vaccinate your child, and it shows, as you can see on the right, all the risks that they are signing off on, and then in one study they showed that vaccine hesitancy was alleviated by making patients more aware of the possible consequences, i.e. the risks of children contracting mumps, measles, and rubella. And this is shown exactly in here, i.e. in the first bullet point it says, I understand that some vaccine-preventable diseases, i.e. measles, mumps, pertussis, whooping cough, are infecting unvaccinated U.S. children, resulting in many hospitalizations and even deaths. So this medical and hospital healthcare lingo tends to scare parents, and while we don't want to scare parents, it sort of nudges them in the correct direction to vaccinate their children. So overall, vaccines are important for maintaining herd immunity, and especially in Arizona, where we are at a 95% capacity for herd immunity, which is good, but if this dips even further, then we are at risk for losing that herd immunity and for gaining all the consequences and risks that come with it, such as a higher rate of perhaps getting an outbreak of measles, mumps, rubella, all these diseases that are preventable and that we as a population do not have to go through because of the invention of vaccines.